This looks like tombstones, right? Kind of. See how it's organized? Think of this like ventricular, so the bottom of the heart, the bottom ventricle, that left ventricle of the heart. Remember how we talked about the left ventricle, the bottom ventricle is this big impulse right here? That is essentially the big impulse of your heart. Real fast. And it's so fast that all of this is buried. Ventricular tachycardia. The ventricle is going real fast. Is this a fatal rhythm? Can be. You can live a hot minute in this because the bottom of your heart's going real fast, right? So the bottom of your heart's still pumping, but it's pumping so fast that it's not pumping a volume out. Think of it as like the bottom of your heart should pump, say, like 70 mLs out every time it closes. This is probably pumping 7 mLs out every time it closes. So it's not enough to keep you alive, but it's enough to keep you alive for like a couple minutes. And then you're gonna go to the light. So you're alive for a couple minutes, then you're going to the light. What is this? VFib, remember? Fibrillation, just doing this, unorganized. Fibrillation is always unorganized. This, DED, dead. You are not gonna have an alive patient in VFib because nothing is organized, nothing is closing to get blood out to your heart. This patient is cold, they don't have a pulse. This patient might have a little bit of a pulse for a minute. I've seen lots of patients have runs of this. So they'll be a normal sinus, then they'll have runs of this, like 10 beats of it, go back into normal sinus. 10 beats of this, they're an AFib maybe, 10 beats of this. Their hearts get irritated when you start doing this. It's like a sign saying their heart telling you, I'm unhappy, get a little nervous. You see this, you have a dead patient. So, tombstones, they're about to go to the tombstone. This one, they're DED dead. What do you do for this? You defib the BFib. So epi, defib. What do you do for this? Shock them into cardioversion. Shock them back into normal rhythm. Is this helpful to anybody?
Yes.
Yeah, this is really helpful.
Just a question.
Just dumb it down. Can't be,